Now let's talk about how insulin works to help manage your child's diabetes. There are different kinds of insulin that last for longer or shorter periods of time. Your child's healthcare team will help you learn to give the types and amounts of insulin that your child needs. Long-acting insulin may be prescribed for your child. It's also called basal insulin. Basal describes the slow, steady release of insulin needed to keep blood glucose levels stable and keep cells supplied with energy when no food is being digested, such as between meals and throughout the night. It's also given at the same time once a day and begins working within an hour of injection. Basal serves as your child's background insulin, the insulin that your child's body needs regardless of food or activity. Your child should never skip his or her long-acting insulin dose, even if they're sick, not eating, or your child's blood glucose is low. It does not have to be taken with a meal. If your child misses their long-acting insulin dose, they are at risk for developing diabetic ketoacidosis. Long-acting insulin cannot be mixed in the same syringe with any other type of insulin. It must be given in a separate syringe and in a different injection site, but it can be given at the same time as a rapid-acting insulin injection. Brands include Lantus, Tresiba, Levemir, Semglee, and Basaglar. Here are some key points to remember when using rapid-acting insulin. Rapid-acting insulin acts quickly within the body. It usually begins within 30 minutes and will continue to work up to 4 hours in the body. It's given before meals to help your child use the glucose from their food, specifically carbohydrates, and/or to correct high blood glucose levels. The number of units given at each meal will likely be different. Your child should always receive their rapid-acting insulin right before they start to eat so that it can begin working while they are eating. Since rapid-acting insulin will continue to work in your child's body for a minimum of 3 hours, space injections out so there is at least 2 hours between administration of rapid-acting insulin doses. Brands include Humalog or Admelog, Novolog, and Apidra. Injecting insulin. Your child's nurse will show you how to give an insulin injection. Here are some helpful tips. Inject insulin into the layer of fat under your child's skin, the part you can pinch. This is called a subcutaneous injection. If the insulin is injected too shallow, it may cause a painful bump or red spot. The best places for your child's injections are the abdomen, the back of the upper arms, the thighs, or the upper buttocks, sometimes called love handles. Make sure the injection site and your hands are clean. Use an alcohol wipe to disinfect the site you plan to inject. Make sure to rotate the injection sites to prevent swelling and altered insulin absorption. Do not use an injection site that is lumpy or painful. If using an insulin pen, you can inject straight in. If using a syringe, inject with the needle at a 45-degree angle to the skin. After injecting insulin, wait 10 seconds before removing the needle to avoid any insulin from leaking out of the skin after the shot is given. If insulin leaks out, you cannot repeat that injection. You must wait at least 2 hours before the next correction dose. Children and teenagers should always have adult supervision. Preparing to inject insulin with vial and syringe. If your child's insulin comes in a vial, you will use a syringe to inject their dose. Here are the steps you should take. Step 1. Wash your hands and gather the supplies. You will need an alcohol wipe, insulin, and a syringe. Step 2. Clean your child's injection site and the top of the insulin vial with an alcohol wipe. Step 3. Fill the syringe with air equal to the total number of insulin units needed. Step 4. Inject the air into the insulin vial, and then turn the vial upside down while the needle is still in the vial. Step 5. With the tip of the needle in the fluid, pull back on the plunger of the syringe and draw up the correct number of insulin units needed. Gently tap the syringe to bring any air bubbles to the top. You may remove these by pushing up slightly on the plunger. Tiny bubbles are not dangerous, but they can decrease the amount of insulin your child receives. Step 6. You are now ready to inject. Preparing to inject insulin with an insulin pen. If your child's healthcare provider has prescribed insulin in a pen, follow these steps for injection. Step 1. Wash your hands and gather the supplies. You will need alcohol wipes, your child's insulin pen, and a pen needle. Step 2. Clean your child's injection site and the top of the insulin pen using an alcohol wipe. Step 3. Screw on the pen needle. Remember that pen needles are single-use only. You should always attach a new needle every time you give your child an injection. Step 4. Prime the needle. Dial the pen to 2 units and then press down on the button as if you are giving an injection and allow the stream of insulin to come out into the air. Make sure you see the stream of insulin come out of the needle. Then make sure the dial returns to 0. If you do not see insulin come out of the tip of the needle, you may repeat this process up to 3 times. If after the 3rd attempt no stream of insulin is seen coming out of the needle, remove and dispose of that needle and attach a new pen needle and prime again. Step 5. Dial the dose you want to give. You are now ready to inject. Disposing of needles and lancets. Following your child's insulin injection, make sure you safely dispose of needles and lancets. Find a strong plastic container with a lid. Bleach and detergent bottles or gallon water jugs are best. Label the container "Do not recycle" using a permanent marker. Put all used needles, syringes, and lancets inside. Do not break them or recap them. When the container is full, cover tightly and tape closed with strong tape. Put the sealed container out with your regular trash. Do not mix it with your recyclables. Insulin storage. Between injections, your child's insulin must be stored properly. Unused and unopened insulin vials or pens should be stored in their box in the refrigerator between 36 to 46 degrees Fahrenheit. When stored unopened in the refrigerator, they are good until the manufacturer's expiration date. When insulin is open or at room temperature, it is good for 28 days. Write the date on the insulin vial or pen when you break the seal. You can store it at room temperature in a dark, cool place. Insulin can be ruined by getting too hot, over 86 degrees Fahrenheit, or too cold when exposed to freezing temperatures below 32 degrees Fahrenheit. Not all insulins will look spoiled. If you are unsure if it is spoiled or you are not seeing the blood glucose readings you usually do, you should discard it and use a new vial or pen. In our next video, we will talk about what a low glucose level is and how to treat this.